Well, thank you for this opportunity. My name is Ben National Grant.
And I'm Raj Punjabi.
And last year at the launch of the Walk Together campaign, we reflected on a lesson from President Mandela. Our walk to freedom often means being willing to walk in the shoes of others. Today, Raj and I want to talk about walking in the shoes of community health workers. When I met Raj in Monrovia in 2005, the civil war that uprooted our families and country had just ended. Liberia was left with just 51 medical doctors to serve a population of 4 million. Way out in Liberia's remote rainforest communities, where people can be days away from the nearest doctor, we're seeing our patients die from conditions no one should die from, because it was too late by the time they got to us. Illness is universal, but access to health care is not. Hundreds of millions of people in rural communities lack access to health care, left behind because they have been taught too hard to reach. We started Last Mile Health to end this, or to change this situation. We work to bring health care within the reach of everyone, everywhere, by investing in community health workers.
Community health workers are young leaders like Serena, who Ben and I had a chance to visit last year together in her village. Hired from their own community, trained in a few weeks by a nurse, equipped with a smartphone, Serena and community health workers like her serve the daily health needs of her neighbors. When a mother in her community is worried that a child is sick with malaria or pneumonia, it's Serena who comes to her doorstep with her smartphone and modern medicine and provides medical care to that child on the spot. And when Ebola outbreaks were spreading like wildfire in our country and across West Africa, it was Serena with many other community health workers who went door to door with doctors and nurses to find the sick, to get them into care, to literally hunt down this virus and stop it in its tracks.
And today, thanks to our former President Ellen Johnson Sirleaf and now President George Weah, the Liberian government, with support from Last Mile Health and others, is hiring nearly 4,000 community health workers who are bringing life-saving care within reach of every last child and family in our country. Now, with our partner, Living Goods, Last Mile Health is working to support 5 other countries across Africa to hire and digitally empower 50,000 community health workers with support from the audacious project.
You know, these countries realize that paying community health workers isn't just the right thing to do, it's the smart thing to do. But to see this movement spread, we've got to work a lot harder. And I want to thank Richard and Grasa Mikkel and Mary Robinson in particular, along with Jean, for the work that they've done over the past year in this space to move this movement forward. We've got so much more work to do. Like Serena, most community health workers are women from poor communities. And most community health workers are still treated like volunteers, receiving little or no pay at all. Asking women from poor communities to work for free is not only unequal, it's unjust. We must help them. We must, with the elders, change this. We must fight with these community health workers. We must help them secure the right to work if we want them to help secure the right to health care. No community health worker, no person has to be left behind if we're willing to go as far as it takes. Thank you.
Thank you.